A short overview of MOSAIQ as it applies to UHG. Notice the ePrescribing status is testing for this patient, which means we are populating their record with drugs retrospectively. Also here, the status, gone live, testing. If it's blank, it means that we're still working off paper. Testing means paper is the primary record. Only if it says gone live should you be using the electronic record of chemotherapy as a decision-making tool. You'll also note that on OTV, pharmacy will record that they are populating the record. Here you can see that most of the protocols are in test zone rather than breast. In other words, they should not be used for clinical purposes. Cycles, a number of cycles, which cycle to start on, are indicated here. This is accessed when the clinician goes into the CWS to start a care plan. Here we have a care plan that has been chosen, and chemotherapy doses to be determined, which is based on body surface area. Here you can choose to approve orders just for the day or for the whole cycle, or just one order. Here we have the BSA multiplied by the dose, which generates the ordering dose. Dosage reductions are possible, but you have to provide a reason. BSA may be reaffirmed if there are several, or on other occasions which I don't really understand yet. Here we have the reason again for a dosage reduction. Doses have now been approved and populated here in dark blue. Once the clinician has approved them in the CWS, the dose gets passed on to pharmacy and can be seen in the dispensing tab here. This allows the pharmacist to provide details of the volumes and rates and verify the different steps that the product is at, print labels and print worksheets. Here we configure the volume and the additive and produce a label and a worksheet which is used for the manufacturing technician to make sure that they do it appropriately and that the product passes all verification. The steps can be verified here, or ticked off, or examined. And here, if the nurse were to tick MO treat, if it doesn't show up, you get it by customizing the top toolbar. The nurse can sign off, they can verify all simply by entering the time and their name here. If the patient, if you don't want to verify all drugs, because usually it'll be one at a time, then you can simply press save and save an intermediate result before everything is entered. If you need a co-signature on chemotherapy, occasionally you do, then you can do that here. Nurses may, if they choose to, even specify exactly where the line is, and they can talk about venous access devices as well. Here. And here we see in aqua blue that the drug has changed colour and it has been given, and the next cycle is planned.